I'm an entrepreneur by heart.
Yes.
Who happens to be a bloody good physiotherapist.
All right. So when did you think that you gotta be a physiotherapist?
I did 1 year of medicine, but then changed over to physiotherapy.
So how many employees you have who are physiotherapists?
So about 25 physios, including in the 3
Impressive.
practices. Yes. So it's a very simple philosophy. I consider them as my work family. I will do whatever it takes, and I'll put them first.
What people should do to prevent injuries when it comes to physiotherapy?
Listen to your body. If you listen to your body now, your body will listen to you. If you give some time to your body now, the body will give you time in there. Good.
Hello Sheena, how are you?
I'm good, thank you.
Excellent. So thank you so much for coming on Bald Waker.
Thank you. My
First time we
pleasure.
are having a physiotherapist on the show.
pressure's on.
Now tell me one thing. The first question which comes to my mind is physiotherapist a doctor?
Depends on where you are.
Okay.
In India it is, and in here, I am Sheena, a physiotherapist.
Okay. So in Australia, people don't consider physiotherapist as a doctor.
No. We are health professionals,
Okay.
we are allied health.
Okay.
But I wouldn't actually have a title of a doctor in here.
Doctor. Okay.
So it's a bit different. The surgeons also will not be called as doctor. That's Mr. So-and-so. So it's only the doctors,
Oh,
GPs, or
okay.
they will be
Okay.
called as doctors.
So when did you think that you gotta be a physiotherapist? When did this thing came up in your mind?
It was actually quite accidental. In there. I did 1 year of medicine. Didn't actually give an exam for that.
Back in India?
Yes.
Okay.
And but then changed over to physiotherapy because I'm a people's person.
Yes.
And actually love being with people, and this
Okay.
is what I do now. And so it was accidental.
So once you come from India, you got married, you came to Australia. What is the process for a new physiotherapist who we are coming from any country, coming to Australia? What is the process?
We have to register in Australia with the Australian Health Professionals Board, and for that we have to give a registration exam, which consists of a theory exam and also a practical exam.
Okay.
So once you clear theory, then you go on to the practical exam.
Yeah.
That consists of about 3 parts: so cardiorespiratory, neurological, and musculoskeletal. So you clear all those 3, and then you become a registered physiotherapist in Australia.
So the duration for that is?
It depends on how good you are or how good the exam is.
Okay, but roughly?
It can take up to a year or 2.
Year or 2?
Yes.
So it's pretty much in last episode we had dentist and she
Okay.
mentioned exactly the same, 2 years.
There you go. Yes.
So it's pretty much the same.
Quite similar. I would
Okay.
say.
And the costs attached to that one would be?
Well, I did that about 20 years ago. So
Okay.
probably
Things have
don't ask me
changed.
that. Yes.
Things have changed. Okay. So if a physiotherapist coming to Australia, who should they reach out to first if they want to practice physiotherapy in Australia?
Yes. So they just go onto the website, like the actual
Board.
registration board website, and there will be process actually explained in there.
Okay.
So there's a skills assessment, then there is like the theory, there's an English exam, then there's a theory exam, and then it's self-explanatory afterwards.
Okay. So once you started the practice, now you are the entrepreneur or owner of 3 different branches. How is this journey? I mean, you are a physiotherapist, you are working for yourself. Now you are employing the new physiotherapist, of course mentoring them, giving them sort of opportunity to reach out to your patients, giving them a shelter. How has that journey been?
So if I have to say, if I introduce myself in a professional background, I would say I'm an entrepreneur by heart.
Yes.
Who happens to be a bloody good physiotherapist.
All right. Okay.
So
Okay.
I had those 2
Skills.
like skills or those mindset in me right from the start. So always wanted to do something for myself in there. So the first step was to be a physio, obviously a registered physio. So once that was achieved, I worked in different aspects of physiotherapy, including hospitals, private practice, rehab, and then I realized that's my niche, like private practice, which is what I do. And then slowly I worked in it. Then I thought I've got more ambition. Let's try and run a practice. Let's try and, have a share in the practice.
So how many employees you have who are physiotherapists?
Okay, so 11, 22, and so about 25 physios, including in the
Impressive.
3 practices. Yes.
Impressive.
Yes.
Excellent. So how is the mentoring been?
So I love teaching and I love mentoring. So not just in physio aspects, I actually mentor in different perspectives as well. Personality development, communication skills. So that's, I'm quite passionate about it.
So do you take like sessions with them on one-on-one?
Yes. So we do one-on-one mentoring sessions with them. That will involve clinical skills and also soft skills or non-clinical skills, which are quite vital.
Okay. Okay.
Yes.
So what's their experience been? Because I know that since when I've started looking at your practice in Wantirna, the faces have not changed.
I hope so.
Which is good
Yes.
for any practice, which is good. But
Yes.
what is so special that you are doing as a sort of not a boss is not the right word, but a mentor who is looking after their employees, of course financially, but giving them a workspace where they are comfortable with. So what's your take on that for anyone who is looking after to open a sort of a franchise?
Yes.
Because Back in Motion, I believe
It's not a franchise anymore.
Okay.
Yes. But
It's-
still, yeah.
so it's what back in Motion
We
is
do have a parent company, and like me as a part owner will have a share on it.
okay,
So,
okay,
yes.
all right.
So it's a very simple philosophy. I consider them as my work family.
Okay.
Okay. So if I will do whatever it takes, and I'll put them first in there.
Okay.
So it's never about money. It's never about increasing the patients in the practice. It's about the people, including my staff,
Yeah.
and also the patients in there. If I do things for them, if I tick all the boxes in the right direction, money will follow.
Okay.
So very simple. I consider them as family.
Okay. And they consider you as a family, of course, as well.
I hope so.
Okay. Okay.
Yes.
Now, when it comes to the practice, when you talk about the patients coming in here, you're looking after all the patients on daily basis. I believe when you are the owner of, not a franchise, but if you're owner of that particular practice,
yeah.
of course you need to do a practice, which is one element. Looking after the day-to-day process of that particular
Practice,
branch
yes.
is one thing, but at the same time, in the background, you are basically need to look after the finances and pretty much everything. So how do you work out those roles on a daily basis?
Well, my day actually fluctuates with different, as you said, rightly said, my clinical skills, and clinically I see patients. I'm a busy clinician, and on the background there continues on with I wouldn't say the financial part is always on my mind, but the day-to-day operations part, running of the practice. But again, I'm surrounded by very good people, and people are my strength. So I would delegate, and I would be very sure that things would be done. I will oversee it, but they're done in there.
But on a daily basis, what is that one thing which gives you stress?
Again, if people, I would say, sometimes, if
Okay.
they're not happy, if they
You
are...
mean patients?
Anyone, it could be
Okay.
staff as well. If they come to me, like, I really need to talk to you for a second, and that actually says, I'm actually treating right now. So if they need to come and see me right now, there is something they are not happy about. So I will probably do whatever I need to push around in my day, and I will listen to them. Because I wouldn't call it stress, but that's important. That is urgent. So people are my strength, and so at the same time, I need to look after them so they can actually be stressful. My
Okay.
clinical skills and clinical routine is not, that's actually a good,
Yeah.
happy place.
Yes.
In there. I love treating.
Yeah, yeah. So when I'm sure because you've got number of years experience, there are patients who are pretty much visiting you on not monthly but sort of yearly or regular basis,
Yes.
depending on what their needs are.
Yes.
What is that common thing which people come to physiotherapists in Australia?
So back pain, musculoskeletal conditions like back pain, headaches, shoulder pain, the list can continue on. Sporting injuries, women's health, like elderly people for mobility assessment and falls risk, those people would be there as well. Pilates, strengthening, we do, like my practice in Wantirna South is actually 2-storied practice. In there. So we do have huge gym spaces. In all the 3 practices, we do have gym spaces, huge gym spaces. So that's a big element. Strength and conditioning is also a big part of it. So yeah, the list can continue on.
Okay.
Yeah.
So if there is one thing which is preventive, and there is one thing when you reach out to a physiotherapist if you are in a bad shape for whatever reason.
Yes.
What is the most important, or what would you suggest to the people who shouldn't be? I mean, I'm not trying to lower your business, but what I want to know is what people should do to prevent injuries.
Okay.
When it comes to physiotherapy.
Of course. And that's something I'm quite passionate about as well. Like health promotion is very important. Like people do things so that they don't reach to us. Okay. So that's always a good thing. I would say listen to your body.
How?
Okay.
How?
Okay. So if you, good exercise, good diet. If you feel that something's not right now, something's aching, something's hurting, don't brush it away because it will just get better. Or I don't have time. I have to go to work because that is more important. Listen to your body. If you listen to your body now, your body will listen to you. If you give some time to your body now, the body will give you time in there. So don't ignore those little things that, okay, my shoulder's hurting today. It will be okay. I'll be fine. No, it needs to be looked at. If the body is telling you pain is not, something that is wrong with you, it's a symptom. It's a way of your body saying that something's not right. I'm not happy. So get it looked at with a professional, whether it is a GP, whether it's, a specialist, whether it's a physio, anyone, but get it looked at. Don't just brush it off thinking it will get better. So listen to your body.
Okay, so in that situation, say for an example, if somebody has fallen, okay, of course it's just a bruise, it'll sort it out by itself.
Yes.
In that situation, people usually go to GP if it's serious, or if they think it's serious.
They think, correct.
Yeah. In that situation, would GPs refer it to you guys on a regular basis? Is there a common practice?
Yes. So the GPs would actually screen it out, like X-ray it out, investigate if there's anything, and that's something which is good, and then they will refer on to the physios in there.
Okay.
So physiotherapy is a primary profession as well. If the patient reaches a GP, then that can be referred as, like the patient can be referred to a physiotherapist, or you could just walk through the door and you could see a physio. So if I feel that person needs an X-ray or a scan, I will refer on as well and have a look. But physiotherapy is a primary profession, so you could just walk in through the door and see a physio.
You don't need a referral of any sort?
You don't always need a referral.
Okay.
But if that's your safe place, that I need to go to my GP and actually see the GP, and then the GP could refer on as well. So we get heaps of referrals from the local GPs.
Okay, but in that situation, I've seen on many websites, including yours, that there are massages as well.
Yes.
There are in Ayurveda, back in India, you have Kerala massages.
Yes.
In Thailand, you have Thai massages.
Yes.
How is a physiotherapist massage different to these massages, which has been there for ages?
Yes. So the massages wouldn't be that different, but the person who's doing the massage is a qualified physiotherapist. Now, this is not undermining any profession.
Yeah, of course.
This is just me saying that person who's doing the massage has at least done this 4.5-year course, knowing the human body, knowing the anatomy, physiology, what's wrong with them. So there is an element of diagnosis in it, and then the massage continues in there.
Okay.
So that's probably the difference. Yes. So it's a massage, but again, if that's not appropriate service, if a client comes in, and I would say you will need more assessment and you will actually need a physio session, then I will advise that way, and then finally it's up to the client or the patient.
But then I've seen many women, including my wife, they basically try and do sort of physio massages on once a month. They should be doing it. That's what I feel. Once a month, twice a month, whatever is possible.
Okay, yeah.
Is it recommended? Any women
Yes.
above 40
Yes.
or even below 40, whatever.
Yes.
What is the recommendation?
So I wouldn't say just massages. Looking after yourself is very vital. So it would be exercising, because we lose about a considerable muscle mass every year after the age of 40.
Okay.
So that's very vital that you look after yourself. So exercises, strength and conditioning, tailored exercises, and then massage to loosen up, whatever, if something's
So
tight.
once somebody comes to you guys, do you also suggest that these are...
Absolutely will recommend that this is what is happening. I will treat what's happened, and then I'll look at a bigger picture. That, okay, for this person to continue on with this healthy lifestyle, like if, say, knee pain, if I have treated someone's knee pain, but for this to stay like this in a healthy condition, what else will be needed? So I will suggest it to the client, and then, of course, it's up to the client to take it on or not. Sometimes there could be time, effort, and money which can hamper that, but that's fine. I've given my opinion, and if next time this happens, then the client knows Sheena had explained this to me. So let's continue on with this. So that's still a kind of a health promotion, because it's recommending it to the client. Whether they take it or not, it's up to them at that stage. But very often we see, okay, you had asked us to do this last time, you'd asked us to do Pilates because my back was hurting. I couldn't do it at that stage because I was going interstate or overseas. But now I would like to look after myself. So that seed doesn't go away. So we would definitely recommend, but whether to take it on depends on them at that stage. But yes, there is recommendation that we give.
Okay. So if, say for an example, at different stages of life, as you said, people can come up. Not necessarily they are facing something, but probably that in the future there might be some issues. So they're just taking advice.
Yes.
At that point of time, the next question is, if somebody has got a medical insurance, does that help in taking a treatment from physiotherapy?
Yes, of course. So with medical insurance, like with health insurances, if you have extras in it and physios involved, so you only pay a gap. Like you swipe it in our practice and you only pay the gap in there. So we take most insurances, or almost all insurances.
And what about Medicare?
Medicare by itself doesn't give you any rebate, but if you go to the GP, well, at that stage it's a GP referral.
Yeah.
If you go to the GP and get a referral for the physio, and then it could give you up to 5 sessions in 1 calendar year, which with most physios it could be bulk billed in our practice, but some of us who are senior physios can have a little bit of a gap fee in it.
So calendar year 1st Jan to 31st December,
31st
not
December.
like the our Australian...
no, not the financial year or anniversary year, but the calendar year in there.
So 5 of them.
5 of them. So that is actually quite helpful. Yes, so you could access... So physio becomes more accessible if funds are an issue, or if you don't have a health insurance. And most of our physios in our practices can bulk bill it, but some of them would have a gap fee because we are just senior physios.
Yeah.
Have some grey hair in there.
Yes. Yeah. So if you compare 0 to 40 versus 41 to 80 as an year, as an age group, what are the common number of people come? Of course, an early stages, the chances of you taking physiotherapy, I believe, would be less. I'm not sure. As an expert, what do you think?
So there are different conditions. So we see kids as well, like I see pediatrics too.
Yeah.
So we do see even babies. The youngest patient I've ever treated was probably about 2 weeks old.
2 weeks?
Yes. So they were having a flat head in there. And so physio could be given in kids. So there are different conditions, and like neurological conditions as well, unfortunately, which we see in babies, toddlers. Then, of course, sporting injuries in younger sort of children or young adults. So the kind of injuries and conditions are different, whereas more in that 41 to 80 bracket that you've said, there are lots of overuse injuries, sporting injuries for weekend warriors, like I need to get my fitness right, let's go and play some sport today, and ouch, something's gone wrong. So those that's a different sort of injury or conditions in those age group in there. So we do see all age brackets, but that's just different way of the way they present, and this is just a rough estimate. in there.
Okay. So when we talk about an entrepreneur who is a wife, who is a mother, how does a day look like when you have duties to look after the people at your workplace, who is your work family, and then of course your family? How do you juggle?
Well, it is not that easy, but I believe I've been doing it now for a few years. So my children are teenagers now.
Yeah. Okay.
So that's completely a different kettle of fish.
Yeah.
So, well, I would say support from my family is quite vital.
Yeah.
So my husband has supported me right from the start in there. So that's very important. My day starts with obviously things with the family, getting the kids to the school like every mother does, and I enjoy doing that in there. Yes, and then once that one thing kind of pauses, I wouldn't say it finishes, but pauses there, and then the different hat comes on board, and then I would reach the practice and start treating, looking at the operations part of it. Once that is done, and then again that pauses, again that doesn't stop. There's never a dull moment, so that doesn't stop. But then you take on another hat as well in there, and then continue with the home life. It is not easy, but I enjoy doing it.
So who is more easy to manage? Is it the family of 2, or is it the family of 25?
I think family of 25. Anytime. It's easy, it's done, and they would listen to me. Whereas my kids, that's questionable.
Yes, true. Okay. So when a mum is working, say 5-6 days a week, I'm sure there are things which you unfortunately miss out on things, because as we said, you have 25 family members who are dependent on you in a way, not entirely, but up to a certain extent. And that situation, what comes up to your mind?
As in missing out in there?
As a parent.
As a parent, yes. So there were a few things, especially when kids were younger in there. So I try and juggle my time in a way that it's not about just the time. It's about, are there any important things coming up? And I will prioritize them in there. So like when my son was in prep, he had this Easter parade, hat parade that was happening. So once I know that, I'll probably, I'll block off my morning in there and be there. So it doesn't always happen, but try and prioritize or distribute my time quite evenly if I can. And a lot comes with organization skills. I have to organize myself a lot in there, as I believe many working women do, or working men and men do. But just strategic organization that, I need to be here now. That is important. That's vital, because this time is not going to come back. His hat parade is not going to come back. And mum needs to be present here. So at that stage, my presence is required here. So I will shift my day around and then be here. And then if something's like we had accident in one of my practices in 2018. So at that stage, I was there from 7 in the morning till 7 at night in there. So at that stage, I was needed there. So everything was, my husband was looking after the home front, and I was there for 2, 3, 4 days, because the practice, it was a bad accident, but we reopened in 2 days. So that took a lot of me. But at that stage, that was required. That was a priority. So planning to prioritize that was important. So both things do require a part of me, but that's always there, because just prioritize and be there at this stage.
In Australian demographics, what is so common which is pretty much uncommon in the rest of the world?
Ouch, that's a difficult question. In a positive or negative way?
Anyway.
Well, I'll give a positive way.
Okay,
I'm a positive person.
No problem.
So I'll give a positive way. People are very stoic. That means they, whatever it would be, like health-wise, they take it quite well. And it wouldn't, wouldn't say bother is not the right word, but it wouldn't. They wouldn't get tense with it or stressed with it because they're very stoic in nature. So that's one thing that I would say everyone in the world can learn from them.
Yeah.
Whatever it would be, they take it on quite well, and I can actually deliver my message to them. So say, once I had seen this lady who had come to me for a shoulder issue. And then I had asked for some investigations, and they came out to be something, it was cancerous in there. It was an accidental finding, but it was so good the way it was. She took it in and she said, okay, what's next in there? So nothing actually pulls them down. So it was a stressful thing for me as well, because this is not my domain to actually talk to people about it. It's a doctor's thing.
Yes.
But I had to explain and give the news to her in the nicest possible way, as you can give. So, but she was very stoic and took it on quite well. It was more about looking ahead what to do. So that's one thing positively I would say, that it's very common in most Australian population.
Okay. Now, I'm sure you treat sports injuries as well.
Yes, we do.
What is the common sports injury patients you get in your practice?
Well, footy is very common. Cricket is very common. So cricket shoulders is very common. Hamstring strains, injuries are very common. Achilles, which is a tendon behind the leg, a bit near the ankle, they are very common in there. Those are very common injuries.
So when we say in cricket that there is a hamstring tear or there is something of that sort and the player is out for 4-6 whatever, depends on weeks, whatever.
Yes.
When you talk about rehab or for a normal person, what is the usual thing they gotta do? Is that, of course, they need to come and see you. You advise them different things. But once they go, do you tell them that these are the sort of exercises you got to do, and then come and see? How does that work?
So I would say the treatment will go into 3 stages: rest, revive, and rehab. Now they are
sorry. Please say it again.
So in 3 stages: rest, revive, and rehab.
Okay.
So it's not like one after the other. They intermingle. But rest is from the activities that cause pain. So if you can't run, then please don't. That's rest. Rest doesn't mean you need to lie down. Revive is what we do as a physio at that stage. If it's advisable, we'll do some hands-on work, some dry needling, whatever is required at that stage in there to revive the rest of the muscle. Say if there's a tear in there. And rehab is strengthening the rest of the muscle, healing and then strengthening. So you could be back to sport, you could be back to work, you could be back to living in there. So those are the 3 kind of stages, and we will explain that. That's our role. It's not just doing hands-on work or exercises. We educate the client quite a bit in there so that they know they are empowered to make sure that they take the right decision in there. Because I can't be there with the patient 24/7. So say if they are in the middle of their journey of rehab and something, my knee's actually hurting today in there. Is it gone bad, or is it what's happened? Is it re-injured? So if you educate the person, you empower that person to actually take the call that, okay, this my physio has said that this can happen. So they wouldn't actually get stressed out. Of course, I would say, if in such cases, ask us, call us, or when you see us next, definitely we'll look at it. But at least we empower the client by educating them. So yes, your short answer to the question would be yes, we would actually recommend them what to do after our treatment as well.
Okay. Now, in sort of diseases, what people have, whether it's cancer, any sort of bad diseases, which can sort of kill you eventually, or you can pass away. Is physiotherapy part of it, or can be part of it?
Yes. So physiotherapy has varied facets to it in there. So it could be more injury prevention. It could be more to keep the person stable and comfortable. Like there could be some neurological disorders as well. Just giving an example. Now, physiotherapy sits into very different facets. I'll just give one example. So say in the neurological condition, if things are, it's a progressive disease, say for example, and things are going backwards day by day. So physiotherapy is very, very, very vital to delay the progress of the disease and delay the effects of the of the disease in there. So say if there is the strength in the limbs is reducing, that means hands and legs is reducing, then physiotherapy plays a huge role to actually delay that progress and keep them stronger, keep them functional for a huge amount of time in there. So very vital in that scenario. It actually changes their lifestyle in there. So obviously I can't do anything to what has happened. That will still eventually, unfortunately, continue on. It's a progressive thing. But to keep their lifestyle better or improved is a vital role that physiotherapists can do in there.
Okay. Yes. Okay. So when people are coming in for certain things, what is the most difficult client you had it in your practice? A story where you felt that, of course we won't take names, but you had this was nightmare.
Okay. So my biggest thing would be when patient doesn't want to improve themselves. Okay.
Are there people like that?
There are in there. So I will actually tell you a success story of this. It was a success story, but it started on a very difficult note. There was this middle-aged lady who had come to me, so I would ask anyone who walks into the consult, what's happening with you today? How can I help you today? And it started on a very negative note, saying, I know you can't do anything for me. It's like, okay.
Good challenge.
Yes.
Bring it on.
Yeah. So we are here. So obviously you want something to be done for you today. So I said, that's fine. That's my job to decide. You tell me what's bothering you and we'll go from there. And so it was a very simple issue actually. She had some headaches, not some, but for her it was not a simple issue. For her, she had, according to her, disabling headaches that she couldn't concentrate onto anything for 15 years in there. And
like a migraine?
Well, it wasn't a migraine. It was a neck headache. But she didn't know what it was, and she just, that was for her, that's her. She's always going to have headaches in there. So she had never seen a physio for that because she never knew that headaches can actually be cured by a physio. So I had seen one of her, I think, family or friends, and then they had said, go and see Sheena and she will help you out. So she was literally forced or obliged to be there sitting in front of me. That's where the thing started. Like, I know you can't do anything for me, but I said, you're still here, leave it to me and just tell me what's bothering you. So she told me that I've got these headaches and everything. So I screened if it's nothing sinister that is happening, but given 15 years, if that's been going on, very less likely that whatever it had to kill her, it would have done by then. So it was more, but I still screened it, and afterwards we actually treated her. So I treated her for 3-4 sessions, and the next time she came in, I asked her, how's the headache? And she started crying. I was like, this is not a good start. And then she said, you actually cured my headaches.
Excellent.
And I didn't know for 15 years that this could be actually cured in there. So they were just stemming from her neck and impacting her life, impacting her family life, social life. And so that's why she burst into tears, that this could have been changed, or this could have been avoided at that stage. And so it was a success story. I was actually didn't have tears in my eyes, but it was actually quite emotional as well. The impact that I could make to her life and her family's life. So those sort of people are more difficult when they don't think that anything could help them.
Okay. So if you consider the whole human body after 40, which we are at, which are the things which we need to consider or need to look after? It's a servicing, of course. Preventive. I'm going in that preventive matter. What are the things whether it's a men or women, or if it's different, then what are the things we should look after? Okay.
So look after your fitness in there. Now, this can be very different for different people. If whatever your fitness level is, try to maintain that. So most people actually take their body for granted, that I could do this, but after 40, things will change. So listening to that, being in tune with the body is quite important in there. So maintain your fitness. If not, improve your fitness if you can.
Listen to your body. I'm hearing this one 5th time. All right.
Okay.
Sorry,
so
go ahead.
that is very important in there.
Yes.
So hopefully that registers.
Of course, absolutely.
So keep fitness is one thing. Then is there any aches or pains? look after that part of it in there. Your diet is important. What you put in is what you are in there. So diet is very important. Then your activities that what you do or were doing when you're in 20 years younger, you may not be able to do that now, whether it's sporting activities or dancing or whatever it would be. So if you are not that fit as what you were 20 years ago.
We know a common patient.
Yes.
Okay.
And so if you can't do that, then either accept that and work towards it, or right from the start, build it up, because you know your body will change. It's a human body. It will. So it doesn't. I don't call it. It's aging. It changes. Okay. So the body changes, and so you have to just go with the change in there. So as long as you are in tune with that, and so that's something I would heavily say. That listen to yourself in there.
Okay. Yeah? Okay. So when people realize it out of 100%. How many percent of people actually take the action, as per is your experience, of course?
So once they have come to us?
No. So I understood that I've got a knee pain. Okay. I've got something which I need to look after.
Yes.
How many percent of people actually wait till the time it gets worse? Or how many percent of the people actually take the action? I know the percentage would be higher for the people who don't look after them straight up, but I want to hear it from you. What's the reality?
So most people would leave it so that it will get better. So I would say if I have to give an arbitrary figure to it in their numbers, then I would say 70% people will just wait until it will get better. And then...
But in actual terms, it gets worse?
Depends on what's happening.
Okay.
If it's like you said, if I've just fallen down, it's a bruise, it will go. But if it's like I was climbing up the stairs and my knee actually twinged, then no, there's something might be happening. Go and see a physio in there. And or go and see a health professional in there. So, and 30% of the people are quite proactive in there. So this is just a rough number. It will depend on the demographics. It will depend on what sort of, area you're working in, what people, who are your patient load and everything in there. So,
Okay.
It's quite a scary number.
I'm sure it must be. When it comes to demographics, the different backgrounds, different race, different countries with people, come to you. Who is the most obedient cohort?
Oh, I wouldn't name names, but that's but I will explain different sort of mindsets. Okay. I'm not going to name names in there.
Okay.
So I would say some people would come in and say, all right, let's just do it, and whatever's needed here, and we will do as I'm asked to in there. So it would be, and the second big difference for this first cohort that I'm talking about is when I see them second time, they see the glass half full in there. How are you today? How was it compared to last time? Actually, it's feeling better in there.
Okay.
And then I would ask, is there any pain? Oh, yes, it hurts with this. So, yes, it's better, but they see the glass half full in there. Whereas the second cohort, the positive. Second cohort, which I would say is they will be a bit reluctant to be there at a physio because they think that it's going to get better. Or the second time when I see them, or subsequent times when I see them, I would ask, so how's it been? How's the back? And they would go, it's still sore. Then I have to actually dig. So there's nothing right or wrong. They are saying the truth, but it's about their perspective of how they see it is quite vital for me in there. So then I will ask, okay, it's still hurting. How is it compared to last time I saw you in there? Oh, compared to that, it's heaps better in there. Okay, so that is better. That's good. Or it was better when I saw you and now it's sore again. So that's good. We are on the right track. If it has an ability to feel better, we are on the right track. Now let's see how we can actually prolong that feeling better. And that's my role. So you change the outlook for the second cohort or the first cohort. If they're like, I'm good, I would have to say, you are good, your pain's good, but you're not there 100%. So I have to call them back, and the other ones I have to show that the glass is not completely empty. It's to show them the positive sort of thing in there. So, and this could happen with, different, it's just mindset of people.
So when you talk about the glass half full, glass half empty, Is there a correlation between mental health and physiotherapy?
Of course, yes.
Such
So,
as?
As in, so I'll just give you my example. If I'm feeling on the top of world today, I can actually see the positive side of it. How are you feeling today? It's hurting, but it's not as bad in there. Whereas if I'm feeling a bit low today, which can happen in there, I will focus on that pain and then, it's actually hurting. I don't think anything's working, it's still hurting in there. So the way you feel, well, that's just one aspect of it. Mental health is just not that. But still, your mental health will definitely have a big role to play in how you feel, how you perceive pain, and how you perceive your recovery in there. So, and that's something as a physiotherapist, we're not psychologists or counsellors, but we actually play a big role.
You're not a counsellor, but still sometimes you got to work as a counsellor.
Correct. So we do that for clients unknowingly. Obviously not a professional advice, but as long as it's in the scope of physiotherapy, I will explain it to them or just show them it's hurting now, but it's not bad. It's just your body telling you that something's not right. Let's just seal that, let's fix that, and things will get better in there. So show them that there is light at the end of the tunnel, or what's happening is not as bad if they are feeling glass half empty at that stage in there.
So if you want to give one advice to anyone, forget about men, women, whatever age, I know you've said that, look after your body. But is there anything that you would really want people, because say for an example, they're not educated, they're not aware of things. What would be that one thing?
Time. Give yourself some time. So whatever you need to do, whether it's your daily set of exercises, daily set of planning your day of what you're going to eat, how you're going to exercise, how you're going to play sport, time. Just spend some time for yourself in there so that you could actually think ahead and make sure that you're not injuring yourself or you're eating healthy. So this is very vague sort of an advice, because it's channeling a general population, but time is something people don't have and don't give to themselves. You keep doing things for everyone else surrounding you, whether it's your family, whether it's your work family, whether it's friends. So time, give yourself, allocate some time for yourself, and you will see the difference.
Okay. So after 40, start looking after yourself a little bit more than what you used to be.
Yes.
Okay.
Definitely.
So Sheena, we've talked about everything from your patients, from your life, from how you manage your life, how you manage your practices and everything. If you want to wrap up your life the moment you landed in Australia till having 3 sort of practices looking after, how would you wrap up all these 20 years in 1 minute?
That's very tough. So once I was in Australia, obviously, as I said, explained physiotherapy, you can't just start practicing straight away. So I had to give my registration exams, and that was a long process for me to be a physio. So to start with, I worked in very different jobs, odd jobs in there. So from really selling credit cards in a shopping center to selling gym memberships in a gym, to being a physio assistant, carrying a bag for people in there for the physiotherapist, whereas myself, I was a physiotherapist. My life in India was, I used to sit in a hospital and I would ask the peon, because there are different people, like labor is very good in there, so easy in there. So I would say, okay, send me the next patient. Marathi sangaisa dusra pathav re. So from that to I was no one in here. So for me, it was required to establish myself here in Australia as a physio. So while that process was going to take time, I wasn't prepared to sit at home. I wanted to be out and about so that I could know how to deal with people, how to communicate with people, because it's a different country. So that's why I've done lots of odd jobs. There were downs as well, like feeling low. At that stage, what am I doing in there? But afterwards, from there, something I would say is don't give up. Take every day as it comes. and step up. Keep thinking of stepping up in your life in there. And that's all I did. Even sometimes practicing Australian accent in there. So I'll still give you an example. I'll sitting in a bus, and I would practice myself. House, like I would say shower when I came from India to here. And then someone explained to me, it's shower. Then I would sit in the bus, shower, shower, shower. So it took some time, determination, and a willingness to get better and get where I wanted to be in there. So from that, obviously, it's hard to sum up 20 years, but that's very vital, that don't take it as a low. Just that's always a stepping stone. You cannot go up if you're grounded, if you're not grounded. So you have to start low, or you can start low, but aim higher. And there has to be strategy. There has to be willingness of whatever it takes. I'm going to reach where I want to be. I want to be where my high is. It would be different for different people in there. So that's something that was quite vital for me at that stage. And I still live up that motto. That doesn't mean that, if things are not right at this stage, then it will only get better in there.
Excellent. Thank you.
No worries.
Now, I know 2 of your practices. Can you please tell me where are your practices, so that people who are watching this podcast this is not a marketing video, but it's always good that people, I feel, that should reach out to somebody who's first of all educated. Second thing is they're passionate about their work, and third thing is they will look after you not only for that one session but for the rest of your life. So
thank you. So my practices are back in motion in Wantirna South, opposite Knox City. That's a practice in there. It's a 2-storied practice in there. Then the other one, the newest one, is in Rowville, back in motion Rowville, and the third one is back in motion in Carrum Downs. So that's more
southeast,
correct.
Excellent. And that will be easier for you to manage as well.
Yes.
Of course. Excellent. So, thank you so much, Sheena. Really appreciate that.
Thank you so much.
We've started from your life journey. You have mentioned what people need to look after on a daily basis. So the essence of it, what I would get, I'll say it again. The essence, what I would get is make sure that you look after your body. Always be positive about how you look at things, and make sure that you take the necessary steps just as a preventive injury, rather than don't wait too long. Seeing a physiotherapist is not going to be expensive affair. It can get expensive if you wait.
Stitch in time saves 9.
So that's it. And I think you covered all the basics. So fantastic. Guys, if you have any questions, please mention it in the comments. We'll definitely get an expert opinion on that one, and look after yourself. Thank you so much. Thank you, Sheena.
Thanks, Mangesh. Thanks.